All right, everyone. On behalf of the Summit co-chairs, we would like to welcome you to the inaugural ASU Digital Health Summit. So I am a co-director who will be kicking things off for us today. So this meeting was convened based on conversations across different experts in digital health at ASU, where we were discussing the interest and need to provide a platform for those interested in digital health to connect with each other across campuses. So we're here today to highlight the expertise that we have across various campuses and colleges and schools at ASU. We're also here to connect those who maybe aren't already engaged in digital health research but are interested in digital health research and might be interested in incorporating digital health research into their future science. So you might be asking, how do we define digital health? So we define digital health really broadly, and it can involve technologies to improve people's health and healthcare, and this includes research in the space of eye health and mHealth, as well as health information technology, use of wearable devices, telehealth and telemedicine, artificial intelligence or AI, and personalized medicine. And the research conducted in this space spans different types of methods. And so these are methods for developing and testing interventions, methods for advanced analytics involving AI, emerging technologies, software, hardware, and community engagement in order to generate user-guided technologies. So we have several goals that we hope to accomplish during today's meeting. So first of all, we hope to promote interdisciplinary collaborations in digital health across researchers at ASU. And so this includes faculty, staff, and students across all of our various campuses. Through our conversations today, during today's keynotes and breakout sessions, we also plan to establish a roadmap that will guide the successful execution of digital health priorities across ASU and will lay the foundation for ASU to become an internationally recognized leader in digital health research. So I just want to take a moment to thank our planning committee. So our planning committee spanned faculty from all across the 4 campuses at ASU. We couldn't have done this without all of their help planning and promoting the event. I also want to thank the College of Health Solutions events planning team for their help with setting up the event for us. And also, of course, thank our sponsors for their generous support. So our sponsors include the ASU College of Health Solutions, Google for Government, and the ASU Roybal Center. And you can see the sponsors listed on the digital banner above. So, many thanks also to all of you for attending today. So we had 260 registrants, and we have 60 plus presenters from across all 4 of our ASU campuses. So this is truly an interdisciplinary event, and we truly have reach from across all of ASU. And we are representing today more than 40 programs across the various colleges and schools, and also including many of our external partners. So very quickly, when we thought about planning the ASU Summit, we wanted to organize around key domains in digital health. So that includes metabolic health, brain health, clinical and healthcare applications, but we'll also be having conversations around workforce development, around the digital divide and health equity considerations, and we'll be having conversations around different types of methods, including methods for constructing and testing different types of digital interventions that involve mHealth and wearables, as well as methods surrounding AI. And we'll also have a technology showcase along with a poster session during the lunch. So the Digital Health Summit is paperless, and so you can follow the QR code here. Also, it'll be on the back screen. You'll actually have access to that QR code throughout today, and then I think there's signs where it's also around the venue. So one thing to notice that when you pull up the online agenda, you'll see that there are buttons that you can click on. Those buttons will give you more information on, for example, location of events and titles of talks and so forth. So you can make choices about that. So the lunch will be served down here, and then we hope that you'll go up to the second floor for posters and our technology showcase, and then during the morning and afternoon breakout sessions will be on the third floor. And then if you parked at the Taylor Street garage, please remember to take your parking slip to the registration desk for validation. So, great. All right, so now that we're done with some business, we will now kick off the summit with opening remarks from Michael Udell, Interim Dean of the College of Health Solutions and Professor of Population Health, and David Kuhn, Associate Dean of Research Initiatives, Support, and Engagement, and Professor in the Edson College of Nursing and Health Innovation.
Good morning. Folks, come on in if you're trying to grab seats. Come on. We'll start with a happy Valentine's Day to everybody, right? Yeah, okay, good way to start a digital health summit. Well, it's great to see everybody here at our inaugural ASU Digital Health Summit. I want to first thank Stephanie and Matt Booman and everyone involved in organizing today's event. Special thanks to the College of Health Solutions Strategic Marketing and Events team and the Summit Planning Committee. Your hard work, of course, made today possible. I wrote a book about 20 years ago called Welcome to the Genome, where sort of at the outset of the revolution in genomic technologies, I remember writing in the introduction that the technologies that were being studied and invented at the time would not benefit our generation, but maybe a couple generations forward. And here we are today, 20 years later, where not only do I have to rewrite that whole book, which we did 5 years ago and now have to rewrite it again basically every year because of the rapid pace of change, but we're in the midst of a digital health revolution, a revolution that is driving change for all of us in how we interact with the healthcare system, in how we are treated when we get sick, and in how we keep ourselves healthy. And it's remarkable, and things are moving fast, and it's why events like today's are so important for us to understand what we in the academic world can do in partnership with our friends in the clinical world and our friends in industry. And today we bring those worlds together to talk about the future of digital health. It is inspiring to see the breadth of expertise represented here today from health and nursing, engineering, psychology, the social and behavioral sciences, business, and beyond. We have an incredible mix of disciplines in this room, which is so important to the success of this digital health revolution. If we rely only on the technology, we're going to go nowhere. We need the social and behavioral scientists to understand the impact of these technologies, how they intersect with different types of communities, and how they will help or perhaps harm the most vulnerable among us. So just really grateful for Matt and everyone on the team. Matt came to me about 5 months ago with this idea, and it's just so amazing to see everybody here today. So thank you, Matt, for your leadership, and thanks to everybody who has made it here today. We are in the midst of our own internal revolution, both at our college and at ASU, in the ASU health space, and we're so pleased to have worked closely with our partners, especially in the Edson College of Nursing and Health Innovation. We'll bring David up in a moment to chat, but of course also the Ira Fulton Schools of Engineering, the School of Social and Behavioral Sciences, the Department of Psychology, the New School of Medicine and Advanced Medical Engineering, the New School of Technology for Public Health, the Health Observatory, the W.P. Carey School of Business, and of course our partners in Knowledge Enterprise. Together we are going to help revolutionize this space. As we push forward in these innovations, we must also keep in mind the ethical and human dimensions of digital health. Really pleased to see on the agenda for this afternoon a roundtable on bridging the digital divide, ethics, and health equity. So thank you for including that in today's discussion. And I'll end it there. Thank you all for being here. Really just so pleased to see so many people here today to think together about these very important issues. David, you're up. David and I we were talking about doing a song and dance routine, but we'll save that for the end of the day.
Yeah, I think there's a happy hour. We'll do it there. Okay, so they're already flagging me for. Anyway, it's all good. So thank you so much, Michael. You said so much here. I know that Matt and Phong would want me to say a little bit about the ASU Roybal, who's one of the sponsors for today. But I also want to send greetings from our Dean Judith Karshmer. And for those of you that don't know very much about our college, while nursing is the cornerstone, it's highly interdisciplinary, and there's lots of faculty here from our variety of different disciplines to interact with. If you ever have any questions or are looking for people that you want to connect with in this space and you don't know someone, get a hold of me. That's one of the things that I want you to do. And I'm already getting these eyes from Matt and Phong, because they said the more you talk, the more you cut into our presentation. So the one thing that I want to say a little bit about ASU Roybal. So when I was asked by then Provost Searle and Ponch to form the Center for Innovation in Healthy and Resilient Aging, I promised that I would get us on the national scene as quickly as I could. So we're very proud to say that this past summer, in addition to all the wonderful researchers we have that are doing R01s and various mechanisms to move research forward in our spaces, we applied for, with Phong as the director. I am the co-director as well, and Ross Andell here, and the blue jacket over there is leading the administrative core. We were fortunate enough to receive a highly competitive National Institute on Aging Roybal Center. And that particular center focuses, it's one of 15 across the nation, and it focuses on technologically enabled social and behavioral interventions for people living alone with cognitive decline. If you're not aware, a growing epidemic in our society are people living alone, older adults living alone with cognitive decline. So we're very excited. We've launched 2 clinical trials already, and we just, on the 18th of February, the LOIs for this year are due. We are asked to stretch across the nation to spread the word in this space and to get more and more people engaged in the activities around this particular center. So if you know somebody you might want to co-PI on, you've got a 2-page LOI that's due on the 18th. Reach out to those people. I might give you a little hint that given we were asked to start some at ASU last year, you might really want to think about who's the lead, but here's this opportunity to get $150,000 each year for 2 years for a technologically enabled social and behavioral intervention in this particular space. So with that, we're really happy to help sponsor this. This is part of our sweet spot, and I'm going to, yes, I'm stopping, okay? They just went like this in the back, all right? So have a great day, and who do I turn it over to? Back to you. Thank you very much.